Our next speaker is Dr. Lew Lim. His paper is titled "A Pivotal Clinical Trial Evaluating a Home-Use Photobiomodulation Device in the Treatment of COVID-19 Respiratory Symptoms." Dr. Lew Lim is the founder and CEO of Vielight Incorporated, or Vielight, depending on how you want to pronounce that. He personally holds the key patents behind the technology of Vielight. He has product development and leads the research efforts of the team. His team is comprised of scientists with degrees in medicine or the PhD in disciplines of medicine, neuroscience, neurology, molecular sciences, bioengineering, physics, and pharmacology. The team also collaborates with other research institutions in its continuous quest for the most effective outcomes from photobiomodulation, PBM. Dr. Lim has credentials in engineering, natural medicine, neuroscience, and various business-related disciplines. He obtained from the University of California at Berkeley, Duke, and Sheffield University, and Quantum University. Please join me in welcoming Dr. Lew Lim to the podium.
Hello, everyone. Thank you for attending my presentation. My name is Lew Lim. I am the founder and CEO of Vielight. Today, I'm going to talk about our clinical trial on finding a treatment for COVID-19. And let's start. This being a regulatory related device and clinical trial, there are some disclosures and disclaimers that I would probably have to do. So I am the founder, CEO, and shareholder of Vielight, developer and manufacturing of photobiomodulation devices. We have developed a novel medical device to potentially treat COVID-19. The device, the Nitrile RX Plus, is being investigated in a randomized controlled clinical trial allowed by Health Canada with a pathway for potential regulatory clearance. At the time of this recording, the result of the clinical trial is pending data analysis. This presentation is not intended to claim that photobiomodulation with a Vielight device will successfully treat COVID-19 or any disease. This presentation is intended to educate, discuss, and demonstrate the scientific basis to warrant a clinical trial for using a device like the Vielight RX Plus to treat COVID-19. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician. So let's move on. The protocol for the clinical trial runs to more than 50 pages. So this is really a brief summary and just highlighting some salient information about the clinical trial. Now, this is randomized, is prospective. One of the notable thing about this trial is it involves a very large number to get the kind of statistical significance that we want. So it involves 280 subjects, 140 in standard of care, which is just like a normal treatment if you contract the disease, and 140 combining the standard of care and with this as an active treatment device. So we administer it for 20 minutes, twice a day, separated by at least 6 hours for the first 5 days, and subsequently once daily. I'll talk about how it is applied. The reason why we do this more treatment in the beginning is because many of you would be familiar with overtreatment with photobiomodulation. We want to avoid that. So once there's sufficient dose being delivered, we want to cut it back. Now, this is important, the primary endpoint. So what are we trying to measure? We are measuring the time to recovery versus the active versus the standard of care. And we use a certain measure that measures the change in the respiratory symptoms, something called the Wisconsin Upper Respiratory Symptom Score. Now, the statistics should be discussed with more detail when we do have the data and it becomes more meaningful. Now, why do we do this? Now, these are the parameters of the device. There is an intranasal applicator using red continuous wave, it's an LED, and very low power because of the nature of being inside the nose, having sensitive membrane around. And then we have a near-infrared LED positioned on the sternum, thymus, lungs, combined it from one position at 50 milliwatts per square centimeter power density. The important thing for us is actually home use. I'll come to why we're doing it in this way. And really it is about delivering photobiomodulation to try and get the optimum results. Now, we're fortunate in the sense that it takes more than a year to develop a device, but we got this going pretty much like 6 months after, the world got into this pandemic, like everywhere was about to go to hell. So it took us a while to get this thing going, to develop a protocol, get professionals together, get approvals, very complicated process. We started in February and we got going with our first patient sometime in September 2020. Now, you can't do that if you're just dreaming about a new medical device, but we have, fortunately for us, this device was available as a general wellness device at the time. A good way of approaching the infection would probably be looking at how the infection progresses at various stages. This is work done sometime last year, just sectionalized it into 4 phases, starting with the nasal area, the upper respiratory tract, following the infection as it goes down to the lower respiratory tract, which involves mainly the lungs. And then it gets really, really serious when it gets into the system. The systemic inflammatory response, vascular dysfunction, and the most, the feared cytokine storm and sepsis. I'll talk more about that later. But we really want to see how we can stop or deal with the presence of the virus and also the damaged tissue in the various phases in the body. But things will not go away. You will not, in infection, it progresses, but you still get viral load in the nose as well. Now, eventually, they get to the brain and you get other problems that lead to long haul. We can talk about that later. Let's start with the upper respiratory tract where it starts. So this is pretty obvious why we have an intranasal applicator, right? This is using red. Red doesn't penetrate that deep, but if you look at someone using this device, you can see, the area is pretty much lit up. So it does cover a wide area. Many would know, and if you have some knowledge of photobiomodulation, you know that nitric oxide is released when you deliver red or near-infrared light to the mitochondria of the cells. And this is a good place to start, because this study is telling us that nitric oxide can inhibit the replication of basically coronavirus. Now, there are not a lot of studies, but this was pretty clear what it's able to do in an in vitro study. You look at the three pictures here. You know, this is mock treatment, which is pretty much baseline. When you deliver a 0 nitric oxide donor, you don't see much change. But if you deliver a nitric oxide donor as NAP shot, you can see the reduction in the viral load. So that is a good way to start looking at how we can, deal with the virus. But bear in mind that in the nose, it's not just the virus going to be present. There are colonies of bacteria and viruses already in the nasal cavity. Now, what's the relevance of this? So we talked about delivering rate to mitochondria releasing nitric oxide. Mitochondria actually shares a lot of DNA with the bacteria. And we talk about bacterial colony in the nose, obviously the bacteria. Now, when you deliver to the bacteria, the presence in the nasal cavity, okay, you can expect nitric oxide to be released too. So that's help from the presence of the bacteria in the nasal cavity. There's work done, primarily the people I know, like Ann Liebert and Brian Bicknell, on the effect of photobiomodulation on microbiome. Photobiomodulation can help with the diversity of microbiomes. The microbiome are associated with the immune system. We can expect a better, maybe some strengthening of the immune system when we deliver photobiomodulation to the bacteria too. So this is a good thing. Now, what's really interesting that we can also leverage on is the presence of mitochondria, not just attached to the cells. Now, this is becoming more and more cited because, for a long time, we've been figuring out how we get systemic effects on the body. Somehow it's related to the circulatory system. But this study shows us that actually we have mitochondria all over the circulatory system. It should be present in the nasal cavity, in the capillaries, present there. Now, this study showed that the way they found it was to trace the presence of residual DNA or DNA of mitochondria compared to, say, nuclear DNA. So there are actually more mitochondrial cell-free DNA present in the blood than, say, nuclear cell-free DNA. So it is good to know, and this is an explanation why we can expect that when you deliver red to the nasal cavity, because the mitochondria present can help to release nitric oxide to deal with the virus. There are some studies not very focused on what we want to see, but there are enough to tell us that if you can deliver photons directly to the coronavirus has an envelope, there's a spike. Light from ultraviolet to near infrared or infrared seem to weaken the envelope, which also holds the spike proteins. Now, this will obviously help your immune system to deal with the virus whenever you can deliver ultraviolet to infrared light directly on the viruses. And here we try to deal with it at the point of entry. So the virus progresses to the next phase. It goes down to the respiratory tract, and it goes on pretty quick. It doesn't take more than a day before the virus finds its way down to the trachea and to your lungs. This leads us to suggest that, right, let's deal with now the respiratory spread by positioning LED on where it can reach. But it does more than that. When we position the LED as we try to design to replace on the sternum, somewhere above the thymus gland, we achieve 3 targets. One is the sternum, the bone marrow, and then as it goes further down, the thymus gland, which is the source of the release of your T cells, which is important in the immune system to tackle unwanted pathogens in the body. T stands for thymus, so you know exactly where it's coming from. And then with the penetration ability of the near-infrared light, in this case we use 810, we expect some of it to go to the lungs. And what does it do? Let's start with the stem cells we may be able to release or generate out of the bone marrow. I think this area is quite established. It's been discussed by many studies over the years. We have seen studies where the red laser has been pointed to the bone, the femur, and the leg, and how it's affecting the brain and heart, and so on. Many of the effects of photobiomodulation has been explained with the release of stem cells, and from the bone is mesenchymal stem cells. So these are some of the reviews. There is, I see more and more presented every year. So we know that stem cells are being released, and among them will be the precursor T cells, for example. Now T cells migrate, but precursor T cells migrate to the thymus gland for maturation. Here is a discussion involving, Michael Hamblin is a co-author here, talking about the, arresting age-associated involution of the thymus. Involution is as we age, our thymus glands shrink. And delivering photobiomodulation, say 660, 810, can help to slow down the involution, or actually help with more vitality to the thymus gland. So delivering near-infrared light to the thymus gland may help with its function. So that's why we try and do this too. Now, as the virus progresses down to the second phase, it moves from where it was in the nose, right? And we can talk about the epithelial and endothelial cells, and these are the cells in the blood vessels. When it starts in the respiratory tract, there's not a lot of symptoms being shown, if any at all. But as it progresses down, even in the early stage, the virus starts locking to the ACE receptors and starts doing its damage. So between 1 to 7 days, it starts moving from these, the blood vessels and the outer layer. It goes down deeper into the endothelial part of the cells. Now the endothelium is just one cell thick, so there's not a lot to get into. All the virus needs to do is just penetrate the epithelium. Now the damage is starting to show, right? You're going to show more activity among the immune system, the various cells, the macrophage, the neutrophil, and releasing of the cytokines. Then blood clots starts developing in the endothelium of the cells. Now that's where it starts getting more severe and more complicated. We want to see if photobiomodulation can do anything about this. So studies, because it is COVID-19, so there is a lot of attention. There's some studies being done, but mainly review and see what the possibilities are. And here it says, the reviewers are just saying that, okay, we are looking at endothelial cell damages. Can photobiomodulation do anything about it? And there are references to a number of papers that show that, yeah, let's try and achieve this. And it is starting, this idea is showing in some of the clinical-based investigations being done. This was interesting. It got some publicity. I wish there was more. I thought it was a very good breakthrough. This was a hospital, Lowell General Hospital near Boston, Massachusetts. Dr. Stigman, I think, was the main investigator there. He had help with some other researchers who are more familiar with photobiomodulation at the time. He started with, I remember, an obese patient, one case, who was severe. I think he was intubated, and it shows good results. Then moved on to a 10-patient study, measuring the changes in the symptoms for pneumonia, right? It is called SmartCop here. The ability to breathe, the respiratory symptom, PCRSS in the chart here. And also the swelling and so on in the lung, RALE, looked at the response from patients who are treated with photobiomodulation. Of course, there's a big response. You see all these changes are very significant. Small. It's hard to make a broad-based claim based, we're always going to get pushback from people saying that you only have 10 patients, you treated 5 on normal care and 5 on active. We don't know yet. And it always says, this warrants a bigger study, right? The X-ray shows pretty clear the before and after, the clearance of the glass-like features typically in a coronavirus of COVID-19 infection. Now, doing a big clinical trial is hard with a clinical-based device, and it opens the door to looking at home use, because if you can treat at home, you avoid hospitalization. This is an argument, and it opens the way to easy clinical trials are never easy, but it's a lot easier than trying to do a clinical-based study with a couple of devices and looking for really severe cases. So we want to look at patients who are infected, they have severity. That's how we measure in our clinical trial. Look, we start from at least a certain level of severity in the symptoms and see how it compares between using an active device versus normal care. Now that leads us to the late stages. It can be very fast. I said late, just that it is progression into stage 3 and 4, where it's systemic and does more damage, and that's where a lot of mortality occurs, right? If you follow, and I thought this is a really wonderful way of presenting how we end up developing cytokine storm, sepsis, severe damage to many organs in the body that leads to mortality. So it starts with the virus, the SARS-CoV-2, hitting the epithelial cells, as I mentioned before, getting into NF-kappa B, which triggers the other elements of the immune system to produce cytokines, which are the inflammatory factors, or the NLRP3, which is a inflammasome to go ahead and contribute to developing the cytokines too. And then, of course, the cytokines, these are the usual bad boys, the interleukin 1 beta, interleukin 2, interleukin 6, TNF alpha, and TNF gamma. So these are typical things you'll find, and there are some discussion in the photobiomodulation literature recently showing the presence of these inflammatory factors, cytokines. So it leads to a cascade, the bacterial infection, then you lead to ARDS, acute respiratory distress symptom, sepsis, which is where your body is starting to respond acutely to the infection, and leads to damage, multi-organ failure. It leads to this molecular, what do you call this, the traces, that lead to more activation of the cytokines. Now, the damage comes in at late stages. There is in late stage infected patients, the damages are all over the place. Obviously the lung, the gastrointestinal tract, the brain, the cardiovascular system, liver, kidneys, the microcirculation, the lack of oxygen eventually to your body, even the eyes, showing symptoms of conjunctivitis. So that's where you get into shock. It leads to a shutdown of the body function. So that's the various stages that progresses and possibly to death. Now, treating inflammation is obviously important, and there is enough, I think, studies to show that photobiomodulation can reduce the presence of inflammatory factors. So I thought this was a good one, done by Brazilian researchers. I think some might be present in this conference, showing that it does reduce, when compared to control, and you introduce a trigger for inflammation, lipopolysaccharide, you get these inflammatory factors being formed, and then you introduce photobiomodulation, and then they are reduced. So we see the reduction of IL-1, IL-6, TNF alpha, and so on. So that is a good way. Now, what is also interesting is with photobiomodulation, it releases nitric oxide, as and nitric oxide actually helps to inhibit pro-inflammatory cytokines. And this was an example in a diabetic animal. So again, we see the reduction with the presence of nitric oxide, the reduction of the usual inflammatory factors like IL-6, TNF alpha, IL-1B, and so on. So there is this photobiomodulation effect that does that, and with the release of nitric oxide, it helps to do its job better too. Now let's summarize this a little bit. So we are targeting mitochondrial respiratory chain, releasing nitric oxide, inhibiting viral replication. The direct action of light, is involved in cellular gene transcription. It also destabilizes the envelope proteins. It gets support from the immune system. It prevents, actually, in the early phases, it could prevent the entry into lower respiratory tract. There's obviously antiviral activity. The gene transcription also leads to anti-inflammatory cytokines. Now, photobiomodulation can trigger off TNF-kappa B, which creates inflammatory environment, but it also helps to moderate it. So it gets into a homeostatic condition, and then it helps prevent hyperimmune response and acute respiratory distress. Now, the endothelial and damage has been discussed. The growth factors can actually further help in the repair and recovery of the damage in the lungs. So in summary, based on literature and mechanism, the large clinical trial using such a photobiomodulation device to treat COVID-19 infection is promising. This is probably the largest completed and pending data analysis clinical trial involving photobiomodulation as an intervention for any disease. So let's see what happens. So I might be presumptuous if I say, yeah, it's going to work. You never know in clinical trials. This is a blinded study. So let's see what happens. Now, when this succeeds, we are going to move on to this really disturbing feature of long haul, which has been discussed, those who recovered. A certain percentage of them actually get into continuing fatigue, brain fog, malaise, POTS, which is postural orthostatic tachycardia syndrome, which is like you stand up, you feel faint, but yet the heart is beating fast. That is what we look forward to doing. And so thank you for attending. I want to thank the team at Vielight. We worked so hard to get this off the ground. We are hoping that we get this study done before the infection is over and nobody cares anymore. But it looks like it's going to continue, with the various variants. Viral infection being what it is, continue to mutate. And yeah, so thank you.